Ever wondered what really happens when a dentist says, we need to pull that tooth? Is it a dramatic tug-of-war or something way calmer than your imagination? I'm Rasim, and today we're pulling back the curtain. No scary drills, no horror stories. Just the truth. Dr. Esma is here to spill the secrets most people never hear before they sit in the chair. Stick around, because what you think happens probably doesn't.
Thanks, Rasim. And here's the surprising part. Most extractions are planned, gentle, and controlled. No sudden moves, no chaos. The real story is about preparation, precision, and protecting what comes next. In the next moments, we'll walk through what patients feel, what they don't feel, and why fear usually shows up for the wrong reasons.
So before you imagine the worst, ask yourself this: what if the scariest part is actually the myth around it? Let's break that myth step by step. Please. Let's be honest, Dr. Esma. Most people don't walk into a dental clinic thinking, today's a great day to lose a tooth. They come in after nights of pain, half chewing on one side, Googling horror stories at 2 a.m. Sound familiar? The fear isn't just the extraction. It's the not knowing. Will it hurt? Will it take forever? Will I walk out looking different?
Exactly, Rasim. By the time patients see me, the tooth has already been causing problems, swelling, infection, pressure. What surprises them is this: the extraction is often the relief, not the trauma. Most discomfort happens before they ever sit in the chair.
And that's the twist. What people fear most is often the step that finally stops the pain. So let's talk about why that moment in the chair is very different from what's playing in your head. So this really matters, Dr. Esma, because people delay for months, sometimes years, hoping the problem magically disappears. Meanwhile, that one bad tooth starts affecting everything around it. Headaches, bad sleep, even confidence. I've seen people avoid smiling just because of one stubborn tooth.
You're right, Rasim. I have treated patients who waited until the pain controlled their daily life. Once the tooth was removed, they were shocked by how quickly things improved. Sleep, eating, mood. The extraction wasn't the loss, it was the turning point.
And that's the part no one tells you. The goal isn't to take something away, it's to give your comfort back. Coming up, we'll walk through what actually happens during the extraction, step by step, without the fear filter. Dr. Esma, give us some background here. People think extractions are rare, like a last resort emergency. But from what I hear, this is actually one of the most common dental procedures out there. How common are we talking?
Very common, Rasim. Every day, dentists perform extractions for reasons like deep decay, cracked teeth, or overcrowding. I once treated a patient who ignored a damaged tooth for months. That's not unusual. It's typical.
10 minutes to fix months of stress. That's a stat people need to hear. I see. And it sets the stage for what's next, because understanding the process changes everything. Alright, Dr. Esma, let's put the lab coat on for a second. From a science point of view, what's really happening during an extraction? Because people imagine force, pressure, maybe even cracking sounds.
Great question, Rasim. Scientifically, we're not pulling, we're releasing. Teeth are held by tiny ligament fibers, not glued into bone. We gently widen the space, let those fibers relax, and the tooth comes out with minimal trauma. That's why modern techniques focus on precision, not strength.
So it's more biology than brute force. That alone flips the whole fear narrative and explains why recovery is usually smoother than people expect. Okay, Dr. Esma, walk us through it like with a patient. Door closes, chair reclines. What happens first, step by step?
First, we numb the area thoroughly. This is the longest part, and comfort is the goal. Then we test gently to be sure you feel pressure, not pain. Next, we loosen the tooth by relaxing those ligament fibers we talked about. Once it's mobile, the tooth comes out smoothly. No rushing. Finally, we clean the area and place gauze, so healing starts right away.
That's it? No drama, no surprises? Just a clear sequence. Knowing the steps alone already lowers the stress, and we're not even done yet. Now, this is where people can accidentally mess things up, right? Dr. Esma, the tooth is out, relief kicks in, and then someone thinks, I'm fine, back to normal. What are the big don'ts and don'ts?
That's the danger zone, Rasim. The biggest rule is protect the clot. No rinsing aggressively, no straws, no smoking early on. Those actions can delay healing. Do rest, keep gentle pressure with gauze, and follow the instructions exactly. Healing starts immediately, but it needs cooperation.
So the extraction isn't the risky part, ignoring aftercare is. That's a key mindset shift people need before they ever leave the clinic.